Dr. Campbell and I wanted to come on today. We want to talk with you today about how you will know if you've got an oral problem that's directly affecting your systemic health.
You know, your mouth talks to your body and your body talks to your mouth. And so there's clues that your family practitioner can identify in your visit that might need to be seen by the dentist. And there's things the dentist can see that might need to refer to the doctor. So we want to make sure that everybody is aware so that we're all talking on the same page. So there's really some major objectives for our little chat today. We're going to ask about what is whole body health care and how dental care affects the whole body health. How a doctor can know that some of these symptoms have a dental root cause, because not all doctors, I certainly wasn't aware for many years of the powerful impact. It seems like, you know, by the time you get out of college, they cut your head off, and then some specialists take care of the head part and other specialists take care of the rest of the body. And I want to put the head back on the body so that we can talk again about how we know when they're connected, right? The role of patient history and some of the stories that the symptoms, what the patient has been through before can give me as a doctor a clue that we're going to have a dental contributor. And then what dentists and doctors both can look for in the exam, and patients can look at these same things themselves. And then some lab tests that I do that give me a clue that my dentist needs to be partnering with us to get the best patient outcomes. And then something that maybe your audience may not be familiar with, what I call esoteric and energetic testing, which is not something in the conventional world. It's purely confined to the integrative and holistic world. So we'll hopefully teach your audience a few new things. So
that sounds great.
Yeah, and we do this together. So Dr. Amy and I are only a few miles apart in suburban Atlanta. So we live and breathe this. I send her patients, she sends me patients. Our patients are connected, knowing that we have a team of providers that are looking out for their whole body care. So I believe that no cardiovascular prevention program is complete without a dentist and a hygienist on the team. So we have to have an interested and educated physician, an interested and educated dentist, an interested and educated hygienist, and then often we'll pull in other specialists wherever it's relevant. Some of the people that I refer to on a regular basis are acupuncturists, massage therapists, myofunctional therapists, chiropractors, and osteopathic physicians for their ability to do craniosacral manipulation as well as whole body adjustments. So this is not by any means meant to be an all-inclusive list. We've referred to Reiki practitioners. We referred to let me think of some of the other people. We just have so many people that it sometimes takes to get people better. I had to see a functional neurologist. I had a serious car accident. I was rear-ended by a semi-truck. And it turns out that when you have a whiplash injury and you get that whole cervical spine irritated and inflamed, those muscles contract and affect the TMJ. So I developed TMJ problems for the first time in my life as a result of neck injury. And so I needed to see a craniosacral massage therapist as well as a functional neurologist to help me recover from my concussion and jaw issues, as well as my neck issues, all related to the same wreck. So it helps to have a lot of education and know who the best people in your community are to refer. We are blessed to live in Atlanta, a large city with many subspecialties.
That's true. So, there's so much overlap.
Yeah, a lot of overlap between. And sometimes the same practitioners don't have an equal skill set, right? I mean, just because you're a chiropractor doesn't mean you necessarily specialize in the TMJ. And just because you're an oral myofunctional therapist doesn't mean your airway is your thing. You might like to do little kids, right? So everybody has their own specialty, and it helps to have a Rolodex as a practitioner of who likes to do what in your community.
It does, and if you're shopping around for a doctor or a dentist or any health practitioner, one of the questions you might want to ask as a consumer is, how do you get out there in your community, and do you work with other people often? Because that collaborative effort can really help the patient win or get the best healing outcome possible.
Absolutely. So how does a doctor know if the patient has a symptom with a dental root cause? Well, I like to think there's kind of 4 primary categories. One is the patient history, the next is the exam, the third is laboratory findings, and the fourth are these esoteric testing. So let's kind of dive into each of these. So when I was in medical school, they never taught me to take a dental history. I didn't know how to count the teeth. I didn't know what was number 1 and what was number 20 anything, right? That was completely foreign to me. And I was never taught to pay attention to these sort of things in a patient history. So now I take a past medical history, a past surgical history, a family history, a social history, and I now include a dental history on my intake forms for all of my new patients. And in those things, I ask, do you have any fillings in your teeth? It used to be easy to tell because all fillings were amalgam and they were silver and you could just look in the mouth and count them. But these new fillings made out of composites are nearly invisible and I can't see them. Maybe an experienced dentist can, but as a family doctor, I don't identify them. Certainly don't have a microscope in their mouth to check for it. So I have to ask.
They're hard to see in X-ray.
Yeah, X-ray will show them. X-rays will show them, but I don't have dental X-rays in my office. Extractions. Do you have a history of having any teeth pulled? Do you have any teeth with root canals? Are there any crowns on your teeth? What about periodontal disease or pocket depths? I believe that dentists should be educating their patients what is a pocket, how deep is normal, and they should know their numbers, just like we should know our cholesterol number, our blood pressure number, our body mass index number. These are numbers for our health that we should be aware of, and what our numbers are and what our target is. And I think the same is true of pocket depths. So I ask the patients, do you know what millimeter depth your pockets are? 99 out of 100 patients do not. But by me asking, it teaches the patients that I am truly interested in their dental health. And I say, you don't have to know today. You don't have to call your dentist and find out and tell me. But the next time you're there, engage in that conversation and ask your dentist, do I have any periodontal disease and what are my pocket depths? And the hygienist can help you and the dentist can help you understand what that is and what that means. Another question on the patient history is, do you have bad breath? Not all bad breath has an oral cause. Often bad breath is from a deep gastrointestinal cause where the patient is fermenting their food in their GI tract and improperly digesting it, and those fermentation gases are coming up and out their mouth. But if you have bad breath, it could be a clue that there may be a dental issue. I ask the patient, when you brush your teeth or floss, is there any pink in the sink? Pink in the sink is a 911 dental emergency. I want you to let your dentist know right away. It doesn't mean you have to be seen today, but it means you have to call your dentist today and let them know that you didn't used to have pink in the sink and now you do. And that's something that you want to get seen and taken care of right away. I ask, do any of your teeth hurt? Your teeth shouldn't hurt. If they do, that's a conversation that you should have with your dentist because very likely there's something amiss that could be affecting your whole body health from a dental problem. I ask the patient, do you snore? You'd be shocked when you ask how many people do snore. Many people say they don't know, that I'm asleep, I never noticed. But we can ask, did your bed partner ever comment that you snore? And often the answer is yes. If the answer is yes in my office, I keep a questionnaire called the Epworth Sleepiness Scale. There's several scales dentists and doctors can use to evaluate if the patient's likely to fall asleep at inappropriate times, because excessive daytime sleepiness is one indicator of a problem overnight where you are not getting deep restorative sleep, not getting enough oxygen to your tissues, and risking physical health to your whole body. You don't have to snore to have apnea, and you can snore and you don't necessarily have apnea. So it's not a one-to-one correlation, but it's something that we want to investigate and take a serious look at. And then the last question to ask is, do you smoke or do you chew tobacco? Since I have a wellness practice, I've kind of gotten out of practice asking this. I just assume my patients don't smoke. If you're here to get wellness and bioidentical hormones and you're talking about health, surely you're not a smoker. And you would be shocked at how many patients are closet smokers. So it behooves us to ask the question. And
can I interject that?
Please.
The second, go ahead.
I was just going to say, if your doctor doesn't ask it, you should volunteer it.
That's true. And another thing to hook onto the smoking is if you vape, because that's a popular thing right now for people to vape. And carcinogenic load in vaping, I'm told, is worse, a lot, like exponentially worse than smoking. That's one thing.
And the young people, especially the 20-year-olds, are thinking that there's no risk to vaping because it's not burnt. But that's it's still a dangerous habit to have, and it can affect your oral health. It can affect your lung health. So your doctors and dentists need to be aware of what your personal habits are, because they can really matter. So what's the next thing we look for? Well, I think on physical exam in my office, I say vital signs are vital. And I want every patient to get their vital signs checked every visit. Sometimes the patients get annoyed because, you know, they come in for, I don't know, a vitamin B12 shot and we check their blood pressure. Well, I also want to know that if they pass out because they got a shot, I want to know what their blood pressure was before they got their shot. So it helps me to know ahead of time. So blood pressure is vital. I believe that it's not inappropriate for a dentist to check blood pressure. Not every dentist office does, but I think it's not a bad idea. The more health professionals that keep their hands on the patient, the more data we can have and the better we can all be. I don't expect a dentist to write a blood pressure prescription, but I think if the dentist is measuring their blood pressure and it's very high, they might want to delay some dental procedures until that blood pressure is under better control.
We can also check for blood sugar levels. If you have bleeding gums, it's really simple to get a blood sugar reading on that blood exudate. That's a really interesting point, right? So is, Dr. Amy, is diabetes, can you see evidence of that in someone's mouth? Definitely. About a third of gum disease patients have diabetes. So
and in fact, I've had patients that were diagnosed diabetic because of their visit to the dentist, that they were having bleeding gums, and the dentist could not get the bleeding to stop and said, something's going on. And, you know, because bacteria love to live on sugar, right? Yeast loves to live on sugar. If you're making bread and you add yeast into the flour mixture, how do you make the yeast grow? You put sugar in it. That's fuel for those yeast to grow like crazy. Well, in that periodontal pockets, there's many organisms that can live down in there. Not just bacteria, but yeast can live there, parasites, amoebas, all kinds of nasty critters can live in those pockets, and sugar just makes them so happy. So this is a great way for us as practitioners. I'm a physician, I'm not a dentist, but I can see if somebody has pockets of pus in their gums, right? So I look at their teeth and I make a general assessment. The teeth are in good repair, they're not in good repair. I work with a scribe who takes my notes. This morning I was dictating the physical exam and I could see plaque on her teeth. So I'm like, it's COVID-19. When was the last time you were at the dentist? She said, oh, well, I've been afraid to go. I said, don't be afraid to go. Your dentist is very likely the best, safest place right now. They are so fastidious about cleaning and patient protection and extra gowns and extra masks and hoods and all kinds of stuff. Call your dentist. Ask them if they've increased their patient protection policies since COVID, and I think you'd be surprised what you would learn. So please go get your teeth checked. Another thing I look at is the tongue.
Yeah.
So we say stick out your tongue. What did I used to look at when I said stick out your tongue? I used to look at their tonsils. That's all I ever looked at. Now I have a whole different approach. Now I'm trying to learn traditional Chinese medicine tongue diagnosis. So I'm trying to pay attention to the tongue size. Is it wrinkled? Are the edges scalloped? Is it coated? Is it smooth? Is it gray? Is it pink? Is it purple on the tip? What's the shape of it? All of these have diagnostic clues that ancients have studied for thousands and thousands of years. And if we take their wisdom and experience into our own practice, we can help patients in so many more ways than if we're just sticking out their tongue and looking at their tonsils. Another thing I assess.
I was just going to say, same thing as when we see them in the dental chair, there's a lot of vitamin deficiencies we'll see by looking at the tongue. Like you're saying, like B12, they might have a very pale tongue because they're maybe slightly anemic. If they get cracks in the fissures of in the corners of their lips, they might have a riboflavin, which is a vitamin B2 deficiency. Bleeding gums can be a vitamin C deficiency, or it could be full-on periodontal disease. So there's lots of considerations.
Right. I do look at the tonsils, and we have a scoring system that we use to see where the uvula, that little boxing glove that hangs down the back of your throat, if it touches the back of your tongue, or if you can't even see it, we use a score to describe that. It's called the Malampati score. And the smaller your airway is, the least likely we are to see that, the more likely you are to have sleep apnea. Also, another thing to assess for is tongue tie. I didn't realize that this was a problem for adults. I thought everybody outgrew it. But it turns out that if you can't get your tongue on the roof of your mouth and open your mouth at the same time, you have a serious problem that your dentist and hygienist should be able to assist you with. Sometimes, even as adults, they end up needing surgery to clip that tie. It can be remarkable at how much improvement can happen in the patient's breathing from fixing a fascial tie in the tongue. And then the neck, we go all the way down to the neck. So we assess the thyroid, the lymph nodes. I listen for bruise or plaque in the neck. It's very, very connected. Whether or not a patient has atherosclerosis or hardening of the arteries in the neck is highly associated to what their oral health is and if they have bacteria in their mouth. So these are some lab tests that I sometimes use to help me as a primary care doctor assess whether or not the patient needs to see a dentist. So these labs are drawn from Quest Laboratory that now owns Cleveland Heart Labs. So these are considered high-level cardiovascular screening labs. And these 6 tests on this panel are called the FAIHM panel. So the first 2 markers are called myeloperoxidase and LPPLA2. And these are markers of enzymes that are made by white blood cells. So we have to go back a little bit and learn a little about physiology. So in the old days, we used to think that cholesterol clogged an artery, much like grease clogs your plumbing drain. And we now know that that's not true. That the plaque forms within the wall of the artery itself, not where the blood flows, but behind the drywall. And so that plaque is a little streak and then a little thicker and a lot thicker and a lot thicker. And it acts like a volcano. It rumbles, full of inflammation. If there's inflammation within the wall of the artery, it's more likely to rupture. And a plaque rupture is what causes the sudden event that results in a sudden stroke or a sudden heart attack. It's not that cholesterol suddenly clogs the artery. That's not how it happens. It's a blood clot that forms. And so we know that clot-busting drugs can sometimes be given in the emergency room to break open that clot and erase the blockage so that blood flows and the patient doesn't suffer permanent damage. But if there's a blood clot in an artery and it's big enough, no blood gets past that clot. And the tissue that was fed by that vessel now is choked for oxygen. It doesn't get any blood supply, and it may die. If that section of tissue that was perfused by that vessel is a piece of heart muscle, you'll end up with a heart attack, a small patch of dead muscle in your heart. If that happened in your brain, that can end up as a stroke. That small piece of brain tissue will die if there's a clot in a blood vessel that was leading to it. If that damage happens in your eyes, it can cause blindness. If it happens in your kidneys, it can cause kidney failure. If it happens in your genitals, it can result in erectile dysfunction for men and sexual dysfunction for women. So we don't want to have vessel disease. We don't want to have atherosclerosis or hardening of the arteries. Anything that we can do to prevent that is paramount to the patient's long-term health. So I have markers that I can look and see. Is there plaque rumbling behind the drywall? And myeloperoxidase tells me that that plaque is not only within the drywall, but it's ruptured into the space where the blood is flowing, and that patient is at very high risk for a sudden stroke or heart attack. Why is that important to a dentist? Because it turns out that mouth bacteria can get through those bleeding gums and get into the bloodstream. Those little bacteria have spikes on them that can puncture a hole in the artery and cause a plaque rupture. So indeed, mouth bacteria can be the reason for the sudden event that causes heart attack and stroke. And in my patient population, every single patient that has had a sudden change in their cardiovascular health, whereby they suddenly got hardening of the arteries that they didn't have before, or they had angina pains that brought them to the emergency room, they were thinking they were having a heart attack. Every single one of those sudden shifts, the patient had a toothache. It is not rare. It is not rare, and people don't make the two and two connection that their dental health was causing trouble with their physical health. So these labs, please.
Go ahead. I was going to say that there was a Finnish study published within the last 10 years. They did autopsies on over 100 patients who had passed from a myocardial infarction, a heart attack, and about 40% of the patients had bacteria in their heart valves that only caused gum disease, and about a third of them had bacteria that caused cavities. And so it seems to also, it's interesting to me that it's a lot of these virulent types of bacteria in the mouth that are also, they say, possibly responsible for these, like what you're saying, for this heart damage that leads up to a heart attack.
Yeah, and in a different study, they took patients that were having a carotid endarterectomy, a bypass procedure where they had to cut out a blockage and reconnect the arteries. So they took that little bit that they'd cut out that was full of plaque, and they sent it to the lab to be analyzed. And in one study, 100% of all of these plaques in the neck had mouth bacteria living in the plaque. So this bacteria seems to get in the bloodstream and can go anywhere in the body, but it also may go directly through the lymphatics or down the nerves and transmit directly into that short passage between those tooth roots and the neck itself. So I can get a clue. In this case, this patient here has this elevated LPPLA2. So this marker tells me that patient has rumbling atherosclerosis. I believe it's my responsibility as a primary care doctor to circle this lab, tell the patient, and if I know them, call their dentist and say, this patient has LPPLA2 elevation. Will you please double check and make sure that they don't have any rumbling dental disease at their tooth roots or in their gums that might be triggering this elevation. The next marker here is called high sensitivity C-reactive protein. C-reactive protein is just a non-specific inflammation marker. It can be elevated from any reason. We've seen huge elevations in CRP in COVID patients. We see C-reactive protein elevated when patients have surgery, have a car wreck, are pregnant, have dental disease. So I can't tell where the C-reactive protein is coming from. It can even come from inflamed arteries. But if their C-reactive protein is elevated and they have some of these other markers, I'm asking my dentist to take a look for me and to be sure that everything's okay. One thing that's very fascinating, and we'll talk about root canals in a minute, is that think about a root canal tooth has had the nerve removed from it. So the patient might be having this. I would not be surprised if this patient here with all of these yellows and reds had an infected root canal. Mm-hmm. But the tooth doesn't have any feeling. So the patient has no symptoms. And so they don't know to go to the dentist because they don't feel a dental problem. Their dental problem is causing a blood problem, but they didn't appreciate that it's causing a mouth problem, so they didn't know to go to the dentist. But we can help encourage that because we have a partnership with our dentists. These next two markers here are called, this next one's called microalbumin creatinine ratio. So albumin is a protein, microscopic amounts of it can leak into the urine. So the kidney cells are supposed to be glued tightly together so that they can filter all the toxic stuff out of your bloodstream, take the water out, and make urine out of it. There shouldn't be any protein in your urine. If you go to the bathroom and you pee foam and you see bubbles in your urine, that can be a sign of protein in your urine, and that is not supposed to be there. We can measure this blood test, or this is a urine test, to see if you have microscopic amounts of protein in your urine. If you do, it means those kidney cells are not glued together. They're likely swollen and inflamed, and therefore they don't glue together properly. If they're swollen and inflamed, protein can leak out of the bloodstream and go into the urine. Well, one of the things that swells up kidney cells is anti-inflammatory drugs like Advil or Aleve. Other things like infections can cause the kidneys to swell. Dehydration sometimes makes the kidney swell, and so does dental disease. So when I see elevated microalbumin creatinine, I'm thinking, does the patient need to go to the dentist? The next two markers here are ADMA and SDMA. These are markers of what we call endothelial dysfunction. So an artery has a lining called an endothelium, and that lining helps the blood vessel behave properly. What do you mean by that? Well, blood vessels are supposed to contract and relax to regulate blood pressure and flow to the organs. Well, if that vessel is not functioning well, we call it endothelial dysfunction. There's a lot of reasons for that. If the body is rusted because it doesn't have enough antioxidants and it's too oxidized, that can cause endothelial dysfunction. High blood sugar, high insulin, these cause endothelial dysfunction. Over-exercise can cause endothelial dysfunction. Not enough exercise can cause endothelial dysfunction. And sugar can cause endothelial dysfunction. So we like to keep track of whether these markers are elevated or not.
Can I ask you a quick question again?
Please.
So you're calling this the fire panel. And so I had learned, or I think I heard along the way, that the endothelial lining, knowing this endothelial dysfunction, if it's truly a problem or not, is the best way to predict possibly if you are going to have heart disease issues, because the endothelium is what should be constantly regenerated to prevent atherosclerosis. So is that what you see too?
So I think that that's absolutely correct. Although I think you can also get fooled, because I sometimes will see atherosclerosis and the ADMA and SDMA are not abnormal. So when they're abnormal, they're hugely important. When they're not abnormal, don't let it fool you and think the patient's scot-free and doesn't have a problem. Because we now know that atherosclerosis, or hardening of the arteries, is much more due to inflammation than it is due to cholesterol. And that's why I put so much effort into this panel, because I call it a fire panel, because it's showing me inflammation. Inflammation is the root of almost all medical evil. And so inflammation's good, don't get me wrong. You want inflammation. If I cut my finger, I want inflammation. Inflammation is how my body identifies that I have a problem, stops the bleeding, repairs the skin. But if that inflammation persists and keeps going even after my wound is healed, that's not good. And this fire panel can help me to determine that. We also know that cholesterol is actually good for you. You need cholesterol. You need cholesterol to make vitamin D. You need cholesterol to make estrogen and testosterone. You need cholesterol to make brain cells. And the people with the highest cholesterol live the longest, right? This is a beautiful molecule. Do not be afraid of cholesterol. You can eat almost as much cholesterol as you want, and it hardly affects your blood cholesterol at all, unless you have corrupted cholesterol. If your cholesterol is corrupted, it's a whole nother story. Corrupted cholesterol is bad for you. One of the ways that cholesterol gets corrupted is it gets rusted or oxidized. And just like your engine in your car will not run smoothly if it's rusted, your cholesterol will not behave normally if it's oxidized. So we measure it. We measure this marker right down here called oxidized LDL cholesterol. If you have rusty cholesterol, you have a problem. So you need to see a doctor to help you figure out how to get it unrusty. So that's one test called the FAIHM panel or inflammation panel through Cleveland Heart Labs and Quest Labs.